finally, since we're all talking about the DMHP, is it important that we just take a relook? Is it actually working? Is it not working? Haven't we spoken long enough of the DMHP? It's been 32 odd years we've been saying DMHP, but we don't see too much of progress. Not in terms of fund allocation, not in terms of numbers. And very strangely, there was a study by R.L. Kapoor which says mental health and Indian perspective 1946 to 2003, where he has clearly stated that findings from this study say that both the multipurpose worker and the doctors are not really very inclined to adding this component into their health delivery system. Their morale is low, they feel that they need to be paid a little more, all of which is fine. So one or the other needs to happen. Training is inadequate. Many of the doctors came up with feedback saying they're not able to diagnose appropriately. Even if they do diagnose appropriately, the one thing that poses to be a problem is the dealing with the side effects. So if this is the reality, and if we have been talking about the district mental health program for 30 odd years, and if the very first program, Bellary, has also fizzled out, there's obviously some need for us to take a relook at it seriously and figure, I completely am in sync with the public health system. I know that this is sort of the three-tier system that we need to follow, but what is it that we need to do to make this work a little more? Obviously, it cannot be just about medicines, but a lot of other services, but in principle, it's not working in the first place, shouldn't we really look at it again and look at what we can do to just take a relook at the DMHP itself instead of continuing to believe that it works? And finally, before I conclude, I think what is important when we keep in mind the clients and the caregivers' perspective, in addition to the poverty and the caregivers' trauma of not finding employment and facing questions of what after me, and the client's dilemma of not finding hostels or housing, or the services being very unidimensional, I think what's important is for us to realize the National Health Bill clearly states that health or access to facilities is a right. Now, attitudes and everything else will obviously change if people are aware, people especially from the lower socioeconomic groups are aware that this is a right, which unfortunately they are not. So I think NGOs like us have to engage in a lot of awareness-related programs, and not just general awareness on mental illness, but awareness more tilted towards what are the rights of a person with a mental health issue. Also, I feel very strongly that in terms of policy and legislation, there is a need for the Mental Health Act, the Persons with Disability Act, and the NTA to all go hand in hand. And unfortunately, there isn't too much of meeting it. I'm seeing that there is slowly a dialogue headed in that direction, but there is a need for more convergence. 3, I feel the mental health lobby is very divisive, very, very divisive in its advocacy. I feel that there are different lobbies. Each lobby is advocating for its needs, including the Banyan. But if all of us can just come together and advocate for one or two goals which are common, which is access to care, and we can